Good morning. Thank you all for joining us here at the DuPage County Board of Health. I've brought together our county team today to provide you with some new and very troubling information related to our battle against heroin here in DuPage County. And when I say our battle, it truly is. While this is a very serious public health threat, I am proud to say that we have joined together with our colleagues throughout the region to address this heroin crisis. I want to thank Coroner Jorgensen, State's Attorney Bob Berlin, members of the law enforcement community, including the DuPage Chiefs of Police Association, represented by Deputy Chief Andrew Johnson today, and Mark Piccoli from DUMEG. I thank our host organization, the DuPage Health Department, and Executive Director Karen Ayala for her leadership, as together we have confronted the many issues surrounding heroin abuse and addiction. In fact, many of you in the press gathered here to watch DuPage Narcan program in action as we train some of the 2,700 first responders who can now administer naloxone to reverse an overdose. To date, that program reports more than 150 reversals or lives saved. But now, our coroner alerts us to a new threat, which reminds us all how vigilant we must be. The message is simple. Never before has heroin prevention been more important than it is today, right here in DuPage County. Dr. Rich Jorgensen, if you would please share your thoughts, your data, and your information with us, please.
Thank you, Chairman. My name is Rich Jorgensen, and I am the coroner of DuPage County. And I really thank you today for being here to hear this message and to distribute the important data that we have. I would like to inform the public of 3 disturbing trends which are causing increased overdoses and deaths in the Chicago metro area. The first is that there are large amounts of fentanyl which is being distributed in the Chicago metro area, either mixed in with heroin or by itself. This trend began back in August of 2015 and has increased since. You may remember the weekend in September when the Chicago Police Department alerted that there were 175 overdoses. That week we had 7 deaths, and 3 of those deaths were related to fentanyl. What is fentanyl? Fentanyl is a legitimate medical drug. It is used to treat strong chronic pain, and it's very commonly used in cancer treatments and people that have serious bone injuries, that type of thing. We compare opiates to morphine. That one equivalent of morphine is what we try to compare things to. Pure heroin is 4 to 5 times stronger than morphine in its pure form. When it is cut by the dealers, obviously it is much less than that. Fentanyl, medical fentanyl, is 100 times stronger than morphine, and when made by drug dealers, it can be 50 to 100 times stronger than morphine. The second issue is that fentanyl has been created illicitly now. It used to be only found in medical pharmaceutical supplies. The drug dealers now and illicit chemists are making fentanyl in homegrown labs in America and abroad, and it is being imported into America and sold and mixed into either the heroin or sold separately. As they synthesize these medicines, they were able to synthesize analogs, and another way to think about it is designer fentanyls, like with ecstasy had 200 different types of ecstasies. Now there are multiple types of fentanyls, and these fentanyls are not medical legal drugs. They're not drugs we use in the medical community. They're illegal drugs that are sold in the street. And sadly, these drugs are 5 to 10 times stronger than fentanyl. So one of them that's been identified as 500 times stronger than morphine, and another has been found that is estimated to be 6,000 times stronger than morphine. So you can imagine how dangerous these drugs are. The last point that I'd like to make is that fentanyl is now being illicitly manufactured and mislabeled and packaged to look like OxyContin and Xanax. So it is no longer just being made in the pharmaceutical community. It is being made in homegrown labs, and it is then being packaged. We know for sure that it has been packaged as OxyContin and as Xanax, meaning that it looks like Xanax pills and OxyContin pills, and is being sold. There was one DEA seizure of a package of pills in Mexico, 19,000 fentanyl pills that were packaged to look like OxyContin. These are now being sold illegally on the street, and therefore users don't even know what drug they're taking. This has been seen nationally, and I can tell you that we have now seen this in the area. We had a recent overdose reversal, which is what we call when we use Narcan on a patient who is dying of an overdose. And he woke up and stated that he thought he was taking an OxyContin tablet. So therefore, he was saved by our first responders, many of which are in the room, that were saved by the DuPage Narcan project or program, and he almost died from a drug that he wasn't even aware that he was taking of them. So these three factors have led to an alarming increase in the overdose death. I'm sorry, I was supposed to do this clicking thing and I forgot. There we go. So these slides I've given to you as handouts as well. But I'd like to show you so this is the historical data of the heroin deaths that were in DuPage County. And you can see that we had what we kind of consider the crisis year, and then we decreased the amount of deaths. Unfortunately, last year they were up again, but we did not track all of these drugs because they were very, very unusual. We have not seen a lot of fentanyl in this area until August of last year. So we went back and looked at every toxicology report to try to synthesize this data. And to explain what this is, the blue on the bottom is just heroin in the toxicology. The green in the middle is heroin mixed with fentanyl. And the red on the top is just fentanyl causing that person's death. So in 2015, we had 36 heroin deaths that were just due to heroin, or overdose deaths that were due to heroin. And we had 7 that were heroin and fentanyl, and we had 8 that were just fentanyl. In the previous years, there was literally no fentanyl in any of these medications at all. And as you can see, there was a couple in May, but it really started in the fall and into the beginning of this year. This is the year to date and we really only have data till May because of the delay in our trying to get the toxicologies back. These are very complicated toxicologies due to these fentanyls. Again, the blue on the bottom is heroin, the green is the fentanyl and heroin, and the red is just fentanyl. So you can see that in 2016 so far, we've had only 14 deaths related to just heroin. We've had 12 with heroin and fentanyl, and we've had 10 with fentanyl alone. So this data is very alarming because the fentanyl is being mixed into heroin on a regular basis now. It's not something unusual. It's something that we see on most of the toxicology that we see, and there's an alarming increase in the number of deaths just purely due to fentanyl. So people are taking fentanyl alone as a recreational drug, and again, I remind you that's 100 times stronger than morphine. So as you can see, this trend is alarming. It's important that the public knows of these dangers and that this is much stronger and deadlier than heroin. And I thank you very much for allowing us to present this message.
Thank you, Coroner Jorgensen. Our next speaker, Bob Berlin, I'd like to thank him for the good work that he's done, not only for your official capacities, but also for everybody who's sitting up here, all your availability. I know Bob is our chief law enforcement officer here in the county, and the prosecutor spends a lot of time out at schools, churches, community meetings, spreading the word about heroin and our response. So thank you, Bob Berlin, and if you'd be kind enough to begin our discussion to cut the supply of drugs into DuPage County.
Good morning, everybody. I'm Bob Berlin, the DuPage County State's Attorney. Thank you, Mr. Chairman. The last 2.5 years, we've seen a tremendous increase in the number of heroin cases that we have pending in DuPage County. And despite our efforts in going around this county trying to educate the public and our students in all the schools, the number of heroin possession cases has grown from 57 in the summer of 2013 to over 128 that were pending just a couple of months ago. So it's more than doubled in 2 years despite all those efforts. We make the distinction between addicts and dealers. And I want to make it clear that when it comes to drug addicts who get arrested for just possession of heroin or other drugs, our goal is to get them in treatment. And we have a drug court in this county that has a tremendous success rate. In fact, the success rate is approaching a 50% graduation rate, which is one of the best in the entire country. So that's how we treat addicts. But when it comes to drug dealers, we take a very different approach. And the message should be clear to those drug dealers who are dealing heroin and heroin laced with fentanyl in DuPage County that we will find you, we will arrest you, we will charge you, we will prosecute you, and you will go to prison. And when somebody dies as the result of ingesting heroin or heroin laced with fentanyl, we have an assistant state's attorney in our narcotics unit on call 24/7, and they respond to these cases and work with the police and assist the police in trying to find the source of those drugs. And if we can prove who delivered those drugs that caused someone to die, we will charge them with drug-induced homicide, which is a Class X felony that carries a sentence of up to 60 years in the Illinois Department of Corrections. We have done that, we will continue to do it, and we've had success in those cases. And that message should be clear to anyone coming into this county dealing these kinds of drugs. Thank you very much.
Thank you very much, Bob Berlin. The DuPage Chiefs of Police have been allies in our fight against heroin, and Deputy Chief Andrew Johnson is here from Hanover Park to provide his perspective from the police.
Thank you, Mr. Chairman. So I'm here to represent law enforcement agencies that are participating in the DuPage Narcan program throughout the county, and also the DuPage County Chiefs of Police Association. And today I want to share the perspective of the police officer on the street. We know heroin use is increasing, we know heroin deaths are increasing, and we know there are more saves occurring as a result of the DuPage Narcan program all the time. What we don't know is when these problems will end. I can assure you that police officers want to see less deaths. We want to see fewer drug overdoses, and we know these are complicated problems that are going to require long-term changes in behavior and not short-term solutions. Essentially, we know that this is not a problem we can arrest our way out of. I speak from the perspective of Hanover Park and other towns participating in this Narcan program when I say that our gut feeling, unfortunately, is that our experience is similar to other agencies throughout the state and elsewhere in the nation. Heroin usage is climbing. It's not only a big city and back alley problem. It's here in the suburbs, it's in small towns in America. Police departments are talking about this problem every day internally and how to confront it. But we're also aware that we need to work together with elected officials, with public health and all of our other partners to even start to make a dent in these numbers. We look into the face of heroin and fentanyl on a daily basis, and it's not a pretty picture. The rapid rise of fentanyl use, which is highly potent and extremely dangerous even in small amounts, has alarmed law enforcement agencies and led to the Drug Enforcement Administration urgently putting out a training video for law enforcement officers across the country. There's been exceptional participation and cooperation throughout the county with the DNP. It's been a model program that has been copied by others in Illinois and elsewhere. Approximately 2,600 persons, most of them police officers, have been trained to administer Narcan, which is the inhalant that quickly reverses the effects of a heroin overdose. At the last count, there have been 158 overdose reversals, we call them saves, recorded by police officers using Narcan. All of that is commendable, but we're here today because the drug scourge is getting worse and not better. Last year, the drug fentanyl became more readily available, and opioid overdoses have increased dramatically. As was mentioned by the coroner, there are reports of fentanyl being marketed as in pill form and being marketed as other substances such as oxycodone. These developments, traced back to the fall of last year, have resulted in a dramatic increase in the number of DNP saves this past April and May. These spikes have caught the attention of everyone working against drug abuse and deaths caused by drugs. So our intent today is to raise a red flag among all DuPage County residents that this problem isn't going away, and at this point it's getting worse. I can promise you that police officers will continue to do our part, and we will work with others on long-term solutions. There is no simple answer, but we won't stop trying. And the message that I want to leave today for all the residents of DuPage County and for all of our partners here in county leadership, we stand with you, we're not giving up, and we will not quit. Thank you.
Thank you, Officer. Finally, and perhaps most importantly, our health department leads us in our response to this growing and changing public health challenge. Karen Ayala is here, and she can outline the wide range of our programs designed to positively impact those affected in our community. Karen?
Thank you. Like all the other organizations represented here today, the DuPage County Health Department is extremely disturbed by the dramatic increase in both heroin deaths and the overdose reversals that have been described this morning. The role of public health in DuPage County comes down to essentially two primary objectives. One is to promote physical and emotional health, and the other is to prevent illness, injury, and disability. So clearly, back in 2013, the Board of Health viewed the issue of increased heroin use as one that requires the public health's involvement and leadership. Since that time, we have and we will continue to address these troubling increases by stepping up our public health efforts on multiple fronts and through multiple partnerships. This is truly a multifaceted, complex set of issues that is mirrored across the United States and that is certainly apparent in all corners of DuPage County communities. So we are prepared to use our already established coalitions and partnerships throughout DuPage County to create calls to action that result in solutions. We are working in tandem and coordinating our efforts to leverage greater and quicker outcomes with the Coroner's Office, Chairman Cronin, the County Board, the Board of Health, the State's Attorney's Office, our law enforcement partners, as well as our professional partners in the pharmacy, medical, and dental communities. We believe a collective approach containing multiple strategies, along with these multi-sectoral partnerships, will be the only way to turn the tide against opioid and heroin abuse. As such, our public health call to action is clear. It contains three broad strategies. One is to prevent people from starting to use heroin in the first place. The second is to reduce heroin addiction. And the third is to reverse heroin overdoses. So, starting with preventing people from even being introduced to heroin or opioids. We have broad community interventions, which include strategies such as our RX Box program. We provide our residents with 12 collection sites to safely dispose of their unused prescription medication, realizing that this is oftentimes the first entry into this very long, very dark journey of addiction. This program was initiated in DuPage County in 2009 and has collected over 35 tons of medication. That's 70,000 pounds of unused medication in DuPage County. We are exploring and working closely with the County Board Office to expand this program so that every community in DuPage can have this as a strategy to respond. We are also spearheading the DuPage, together with DuMeg and Mark Pickley, the DuPage County Prevention Leadership Team, which is focusing on education and awareness of the dangers of drug and alcohol usage by all age groups, but especially a focus on young people before they become abusers or addicts. We receive funding through the Federal Substance Abuse and Mental Health Services Administration for drug-free communities in 2015, and we will continue to expand our efforts and our partnership with individual communities going forward. But we also realize that we need to engage our medical professionals and prescribers in our efforts to push back this wave that is coming and has arrived. We need to work to assure that all prescribers have access to and are well versed in updated, safe prescription practices, and that they agree to screen patients early and often, particularly those who are at risk of substance abuse. We want to encourage participation of our medical partners and dispensers in the community to participate in the Illinois Prescription Monitoring Program. That program allows prescribers and dispensers to view a current or prospective patient's prescription history. In Illinois, this program is a voluntary program and is free. It is overseen by the Illinois Department of Human Services and funded through a grant from the United States Department of Justice. But we also realize that once individuals are addicted to heroin, that treatment does work. And so we need to embrace and assure access to medication-assisted treatment and to support policies that would provide greater access to treatment for individuals in this underserved population. We need to, even when treatment is available, we need to provide support to individuals and families to begin their recovery process. And we've been able to do that through the generous support of Member Eckhoff of the DuPage County Board for the Project Connect program. Project Connect program involves DuPage County Health Department staff working with county emergency room personnel to raise awareness of the availability of this follow-up program, which can help people begin the process of breaking the cycle of their addiction. Finally, we need to expand other opportunities for individuals to engage in recovery, such as a community support of self-help groups, such as Alcoholics Anonymous, Heroin Anonymous, and Narcotics Anonymous. Very pleased to share the information that with the opening of the community center in late 2015, that we now have availability of new recovery groups that meet in that location and provide support to those interested in recovery. Finally, we need to continue and maintain our efforts to reverse heroin overdoses. We must expand the use of naloxone, which is already being successfully administered in DuPage County through our DuPage Narcan program. We also must embrace the fact that TELUS treatment works, however, you must be alive in order to recover. As you can see, we are working on multiple strategies with all of our partners across the community to close the gaps related to the increases in deaths caused by heroin usage, as well as the introduction of fentanyl and the number of overdose reversals reported. We are extremely concerned regarding these increases, and we will continue our work to close any gaps that exist in our communities until these trends are reversed. Thank you.
Thanks, Karen. Well, in summary, our goal here today is to protect our citizens, to protect our communities, our families, our children. We are here asking parents, grandparents, caregivers, teachers, camp counselors, anyone who deals with students or young people, please educate yourself and talk to the kids in your life about the dangers of heroin. Please do not assume that someone else is taking that responsibility or that somebody else is doing it. Listen to what the young people are telling you in your life. Keep the conversation going today, tomorrow, next week, next month. They need to know that you're available. They need to know that they can talk about it. They need to know that there are people here that want to help. Heroin and fentanyl are different, and deadlier than anything we've ever seen before. We love our kids, we love our neighbors, our citizens, but we cannot do it alone, the public officials. We need the help of families and citizens and neighbors that interact with children, young people, day in and day out. We're reaching out to you today to ask for your help in this partnership to save our children and save our communities. Thank you very much for everybody coming here today, and I would be happy to invite you to ask questions.
With the that's at 36 already this year, you had what, 43 last year? That is more than almost a spike, wouldn't you say? Well, the 43 from last year was just heroin deaths as well. There were 8 that were fentanyl alone as well. So we really had more than that. But the answer to your question is yes, and that's the reason we're here today. The shocking numbers that alerted us to call this press conference was that last year we used Narcan 63 or 4 times for the entire year in our first responders. To date, we've used it 65 times in 5 months. So we have used the same amount of uses in an entire year from last year and 5 months this year. And this year, as I said, we've got 10 fentanyl alone deaths this year. So yeah, this is shocking. And our office for the deaths that we've had, this is alarming, and that's why we are here today. Yeah. Well, I would start with the Narcan saves and just tell you that the number that about 10% of the people that are saved with the Narcan program are under 20 years old. And about 60% of them are, excuse me, about 60% of them are under 29 years old. So that means that a full 70% of the people that are saved with the Narcan program are under 29 years old. So the picture that we have in our minds, or that I have from my high school mind, of a dirty person laying in the street with a needle in their arm isn't the picture anymore. These are young people. In DuPage County, about 70% of the people that either die of overdoses or are saved are males. And again, they're mainly young. They reflect the population of the demographics of DuPage County. There's no predilection for race, for rich, poor, certain communities. And at least in DuPage County, it's spread all the way around the county. It's related to population. It's not related to wealth. It's not related to ethnicity. It's just related to availability, which in DuPage County is very available. Thank you for the question.
Mr. Cronin, could you address this? You're really shouting from the mountaintop today, basically.
Yes, and I think we are alarmed, and I think one of the more disturbing new revelations is how sinister the drug dealers have become in manufacturing this fentanyl to look like a pharmaceutical drug, an OxyContin, and how really evil and that is, and how dangerous it is, because unsuspecting people may take that medication, and the potency of it is lethal. And so we feel compelled, we feel really motivated to get that message out, and and we're just delighted that you have joined us here today, and we feel like we're fulfilling our responsibility, sounding the alarm, letting people know, and asking them to engage in this fight, to communicate, to know what's going on. We're doing everything we can here on our end, and we'll keep working hard, but we're not winning right now.
Mr. Burrow, can you talk for a second about if you have any idea how it's getting into DuPage County and into Chicago, or do you have any idea on that at all?
First of all, regarding the prosecutions, we haven't had any specific cases of just fentanyl. We're starting to see the fentanyl in mixtures mixed in with heroin. And we've gotten a number of lab reports from the sheriff's office, from their crime lab, with those mixtures. Regarding where it comes from, I think Director Piccoli could probably address that, but the heroin and the fentanyl is coming from Chicago, most of it. And from what I can tell you, that this fentanyl, a lot of it comes from Mexico. Some of it's coming from China through Mexico, and it gets its way up to Chicago. And I feel confident in saying that most of the heroin that makes its way into DuPage County is coming from Chicago.
And just do you have any idea if it's DuPage County residents going to Chicago or Chicago people from DuPage County?
It's both.
Ms. Ayala, could you address, you said you had a program, something that you're doing is working.
Right. This is a very new program. It was implemented just within the last 9 months. And clearly, the grip of addiction to heroin is one that's extraordinarily difficult to wrestle out of an individual. So we have had 3 individuals who have successfully linked and completed treatment and are now engaged in halfway houses or longer term residential programs. So we're starting with 3, and those are 3 lives that we feel very happy are being turned around.
But the problem is that the fentanyls have a longer half-life, or they stick around longer, and they're more potent. So we have to use multiple doses of the Narcan and higher amounts of it. So some of the emergency room in the past would use half of the dose that we suggest the police officers use. We're basically oftentimes using the 2 doses that the police officer carries, and reaching into the pack of his partner. So the answer is that yes, it still knocks the drug off of the opioid receptor, which is the basic principle behind Narcan, and it has saved people who have had fentanyl overdoses.
So yes, we are very confident that the supply of Narcan is sufficient to meet our community needs, both in the short and the long term.
If I could add,
The price, yes. One interesting point is that the price of naloxone has doubled since we started this program. However, pharmacy manufacturers are also increasing the potency of the naloxone along with the potency of the drug. So, a little bit of good news.